Hi everyone, welcome back. Today's video is going to be a little bit different. Not going to be focusing on something sort of about the physiology in particular, like we normally do. So today we're going to be talking about what position you get in the bedroom. Now, don't panic, I'm not going all 50 shades of grey on you, but we're going to be talking about sleeping positions. Now, one of the factors that I look at when I have a client come in is, their posture. Have they got poor posture? Are there, muscle imbalances? And that's not only looking at their standing posture or their sitting posture, it can also involve looking at their sleeping posture, which a lot of people don't think about. And sometimes whatever position a person sleeps in can actually cause lower back pain or shoulder problems or a stiff neck. But in addition to that, it can also occasionally cause some other issues as well, which we're going to talk about now. So possibly there might be a client who they might have pain actually in pretty much any area, that maybe isn't explained by something else, by a medical issue or something. Now the spine forms part of the central nervous system. So if your spine is, out of alignment, then obviously this is going to cause additional stress on the area, causing aches and pains throughout the body, because it might affect, the branches of nerves that, say go off to supply your legs, for example. Also, poor sleeping posture may cause either strained, tightened, shortened muscles, and this can then lead to poor support of the spine, which again is going to further cause, poor posture. Obviously back and neck pain, which we've sort of mentioned briefly already. Fatigue, if you're sleeping in a funny position, your quality of sleep might not be as good either. So then, you're going to be tired the next day, low energy levels. Sleep apnea is another factor. If you're someone who's unfortunate enough to suffer with this, that is really, again, going to interfere with the quality of sleep that you have. Muscle cramping, and again, just through being in unusual positions, it may be if a certain part of your body is kind of all scrunched up, the muscles might tighten and then press on the blood supply. Reduce blood supply, you're going to get a lot more cramping as well. And so, as we've just said, impaired circulation. Quite often, you might sort of wake up and have pins and needles in your arm, if you've been laying on top of your arm, for example. And also headaches, which is a big one that I see in practice, which often is caused by the levator scapular muscle, which runs sort of just from the top there up the side of the neck, but also even the upper back muscles, if they're tightened, they can, form trigger points, which then contribute to a lot of headaches and migraines. So that's certainly a very common issue. Other things, heartburn, digestive issues can arise out of poor sleeping positions. And certainly, if you're someone who maybe suffers with IBS, for example, you may be more prone to heartburn anyway. Now, another one that maybe a lot of people don't think about is actually premature wrinkles. Now, if it is actually the case that if, for example, you sleep on your side and you've sort of got your arms all bunched up, it is a common thing that people can get sort of premature wrinkling around the upper chest area. You know, or likewise if your face is all kind of screwed up for whatever reason, maybe you sleep on your front, you know, it can cause premature wrinkling. So yeah, if you're bothered about aging, then have a look at your sleeping position. Now, despite the fact, obviously we all tend to move around in our sleep, that's normal. Usually most of us tend to hold a certain position for several hours. So as we've said, if a part of the body is kind of twisted or held at an unusual angle, you know, it can then maintain that imbalance when you're awake because the muscles maybe shorten and get tight. And, you know, but there are certain things and certain positions that you can look at to help avoid excess stress on the spine and therefore help to maintain good spinal alignment, you know, maintain a good posture, and therefore help to avoid all these aches and pains. So things you can do to ensure that your spine is, you know, in a good neutral alignment. An obvious one, you know, you can look at your mattress. A well-made inner spring or foam mattress, or, you know, you can even use one of these foam mattress toppers, will help to provide that, just that extra bit of spinal support. But depending on the firmness of the mattress, it may still not support in the lumbar curve, in the lower back, and also the curve in the neck. And it can create pressure points on the back of the head as well, or the shoulder blades, sometimes the tailbone and the heels. So they're also things that you're going to want to look at. And again, you know, obviously if you've got some sort of medical condition, if you suffer with pressure sores anyway, or you're going to be prone to those, maybe due to something like multiple sclerosis, you really want to be looking at, you know, your bed and what sort of mattress you have. Now also, if you've got an old mattress, old springs may press into pressure points, which again can cause more pain. So a good mattress should support the lower back and prevent your lower torso and the pelvis from sinking too deep into the mattress, because again that's going to push that spine out of that neutral alignment. Now another thing you can look at is use of pillows and bolsters, basically to fill any gaps between you and the mattress and therefore support, you know, your spine in particular. If the pillows are too flat, too high, too firm, too soft, the head and the neck will then become misaligned, and this can cause an imbalance around the neck, can cause headaches and also cause shoulder tension as well. So when lying on your side, it may be useful to use a thicker pillow under your ear, or maybe memory foam which moulds to the body. Pregnancy pillows are also a great way to fill the gaps, and you know, as a massage therapist I use these you know, in massages as well, because they're really soft and they support everywhere, and they'll also prevent you from turning onto your stomach as well. Now generally, and this is going to apply more to females, if your hips are wider than your waist, a softer mattress can accommodate the width of the pelvis and encourage neutral spinal alignment, whereas if your hips and waist are relatively straight, a firmer mattress will probably support better. Now obviously if you've got a wide-hipped woman and a man in the same bed, that may not really work very well. So other options you can look at to keep the spine in neutral alignment. Where possible, look at your position, which is what we're going to talk about today. The legs should be fairly straight with just a natural knee bend to help avoid tightening of the ligaments. And the hips should also be aligned with the shoulders, just as when you're standing or sitting. You want your hips to be in alignment. The shoulders should also be, in a relaxed sort of drop down position. And both sides of the body ideally should be symmetrical. And I think a lot of us are probably guilty of, being quite asymmetrical, in our sleep. Quite often, one side is sort of up and the other side's down. Now, if you're someone who maybe due to occupational patterns or, maybe you've already got some muscle tension or weakness, if you have poor posture during the day, this is then going to make it even more difficult to sleep, in a natural position at night. And so stretching or massage can help to correct those imbalances, which in turn should then help to improve sleep. The spine and the joints, are not weight bearing when you're sleeping. So you shouldn't be in pain when you're sleeping. So if you are, experiencing some pain when you're asleep, then that is a sign for you, that you've got a problem there and you need to go and get it sorted. If you have recurrent back pain, it may also be worth checking with your GP that there's not any underlying cause, maybe something like osteoarthritis or slipped disc or sciatica. Okay, so we're going to look at sleeping positions. So we're going to start about talking about sleeping positions when you're lying on your back. Now this is generally considered to be the optimal positioning, but of course, a lot of people don't like their partner sleeping on their back because you are more prone to snoring when you're lying on your back. Now, advantages and disadvantages of sleeping on your back. The advantages are weight is going to be evenly distributed across the widest surface of the body, which reduces those pressure points and encourages proper alignment of not only the spine but the internal organs as well. So again, sort of looking at things like digestive health, it's going to be more beneficial. Now, the spine is also generally more supported when you're lying on your back, and this can therefore help reduce that neck and back tension that I see so much in practice. And it's also less likely to cause wrinkles because everything is flattened out and it's not all bunched up. Now, there are some disadvantages to sleeping on your back. If you're someone who, we mentioned about snoring there, but actually if you're someone who suffers with sleep apnea, lying on your back really isn't a good position. You want to be a bit more propped up or, on your side. And yeah, as we've said, lying on your back, it can also increase snoring. So how do we improve, the back position? Now, the ideal position, and I must say, sort of in my observations through my medical career and also through people that I've slept with, have to say I haven't known many people to sleep in this position, but the ideal position would be the soldier position, which is basically lying on your back, keeping the arms down by the sides. This will really help to reduce the strain on the shoulders. Also using sort of just one supportive low pillow. This will then mean that the chin isn't being kind of, you know, the head's not tilted up and the chin's not being pushed into the chest, which obviously that can, you know, cause some neck strain. But, you know, if you're someone who doesn't like sleeping flat, you know, elevating the upper body, maybe with a sloping wedge pillow or an adjustable mattress, can really help, and it will also reduce the risk of a compressed nerve due to just tilting the head forwards. So that's the first sort of ideal solution. Now, if you really like sleeping on your back, but you find it difficult to, you still kind of feel almost like there's no support, particularly in that lumbar region, what you can do, so usually if you're lying on your back, you're going to have that lumbar curve there. There's going to be a bit of a gap between your spine and the mattress, and also quite often under the knees as well there may be. So what you can do is just use a small pillow under that lumbar area just to support the lower back a little bit more and help maintain that neutral alignment. You can also use a wedge. Now it doesn't have to be quite this big, or even, you know, again, a soft pillow under the knees. And obviously we've talked about the head pillow. You know, you can use more of a wedge there, sort of, that goes just under the upper body as well, but just so the head is nice and level and you're not kind of tilting forwards, which would pull on the neck there. So now, possible issues of people if they're sleeping on their back. One of the positions that can cause issues is for those of you that sleep in the starfish position. Now this is quite a common position. Now some people will just kind of have their arms sort of out to the sides, but a lot of people do put their arms up, you know, above their head. Now if you are a starfish who does this, who has your hands above the head, you may find that this will result in pain around the shoulders, and this is due to increased pressure on the nerve supply in the upper back. So just be aware, you know, having the arms up above the head, not really a good move. Just try to bring the arms down and you'll probably find that that shoulder tension, you know, does improve. So that's lying on your back. So next up we are going to talk about lying on your front, which is generally considered the worst sleeping position. Now the advantages, really the only advantage, is it may reduce snoring, so it may keep your other half happy. But there are a few disadvantages to sleeping on your front. Now one is that the core will probably sink deeper into the mattress because it's the heaviest part of the body, and if that happens then it means that the head and the limbs are going to be higher up, sort of on the bed, which basically will create a free fall position. And in this position the spine will be unsupported. There'll be probably more of a sort of an exaggerated curve in the lumbar region, which you know, puts extra strain on the back, and will cause back pain. Also, therefore, increased stress on the muscles, the joints, and the internal organs, because it's just everything is going to be out of alignment. What it also does is it will lock, you know, the upper cervical vertebrae, and due to the position of the neck sort of almost being where the torso is kind of pushed down, so you'll be kind of pushed down here, and that almost, again, as well as an accentuated lumbar curve, it will also cause an accentuated neck curve, which again may cause not only neck tension but also headaches as well, and you may start developing trigger points and things. You may also get increased nerve compression in the upper back, around the neck, which again, you're going to feel numbness, tingling, and possibly also numbness and tingling in the legs and feet as well. And this is due to increased pressure on the knees, which, you know, again, are going to be turned into the mattress. And possibly even the feet, where the feet are kind of pushed back almost into like a plantar flexion position, which, you know, is generally a sort of it's not a natural position for the feet to be in. So how do we improve this position? If you're someone who absolutely has to sleep on their front, you can't get to sleep any other way, what can you do to reduce the, you know, the risk of nerve compression and headaches and shoulder tension? Well, what you can do, again, you can use a small pillow or just a small wedge under the abdomen, and what this will then push you up, so you're not sinking right into the mattress, and that will help align that lumbar part of the spine into much more of a neutral position. You can also, the pillow under the head, make sure again that it's not a great big thick pillow. You know, if you're a sort of a front sleeper, the pillow under the head should be quite flat. And again, you know, what that's going to do, it's going to avoid sort of extra strain on that curve of the neck there. You know, your head's going to be nice and neutral. It's not going to be like pushed back. You know, even don't use a pillow at all. You know, even that, if it's comfortable, you know, is even better. Now, also to keep the head straight, you can place sort of a firmer pillow under the forehead, and this, you know, if it's just under the forehead, it kind of frees up the sort of breathing area, and, you know, can allow for easier breathing as well, because one thing that probably front sleepers we tend to find is, obviously, they're not going to be face down in the pillow because then they can't breathe. So, as in this picture, they tend to turn their head to the side, and what happens then is you're going to get shortening of the neck muscles on one side and stretching on the other, which means you're then going to wake up, you know, like one of a chicken that's sort of had its neck wrung, and it's, you know, you kind of, and every time you kind of twist a certain way, you're in pain, and you just generally feel a bit lopsided. So we want to avoid that, really. So again, that's where the pillow under the forehead, it allows you to breathe, and it means that your spine is completely, you know, neutral and straight, and you're not going to get that one-sided tension. So possible issues with sleeping on your front, I mean, we've covered some of them there. So again, we're going to come back to the free faller position. So again, facing down into the pillow, as we've said, is going to restrict breathing, hence why people turn their head to one side. But as we've said, this really increases neck strain and pain during the day. You know, and obviously if you've got neck strain, you're then going to find that sort of other muscles will start to compensate for that. Sleeping with a twisted neck can also lead not only to tension in the neck, but also in the upper back and shoulders as well. So the best, well, the sort of in-between solution is to sleep on your side. Now, side sleeping is actually the most common position, with 41% of people sleeping in the fetal position. This is the most common sleeping position. And probably another 15% sleep in either a sort of a looser fetal position where the legs are sort of brought down a bit and more relaxed, or the log position. Now, I don't know how anyone can sleep like this. Just everything is straight, and they're kind of almost on top of one of their arms, which would make me wake up with pins and needles. But obviously it does put the spine, you know, in good alignment. So, okay, so advantages. Now, a loose fetal position, so where the legs would sort of, so the thighs would sort of be looser, they sort of come down here with a bend at the knee. A loose fetal position, particularly on the left side, will help improve circulation, which is why this is the preferred position for pregnant women. If women are in labour, you know, and we see fetal heart rate decelerations, first thing we do is to turn the mum onto her left side, because it basically will prevent not only the uterus from pressing on the liver, but it also helps to prevent compression of the inferior vena cava, which obviously is then goes on to supply all around the uterus and the placenta. So yeah, if you're pregnant, or certainly heavily pregnant, sleep on your left side in a loose fetal position. That's going to be good for you. But otherwise, a loose fetal position, certainly it will help lengthen the spine, which will then obviously reduce the risk of back and neck pain, and also it will reduce the risk of acid reflux. So if you're someone who has, again, IBS or some other sort of digestive issue and you're prone to heartburn, you know, yeah, just a sort of looser position where everything's not sort of all kind of bunched up around the abdominal area should really help. There are, as with the other positions, there are disadvantages as well. You know, if you're always sleeping on the same side, this can contribute to muscle imbalances and pain, because what happens is it will, you know, kind of repeatedly sort of suspend the same part of the body on one side, you know, between the shoulders and the hips. And so that is then obviously going to put your spine a little bit out of alignment. So if you are a side sleeper, do try to swap sides, you know, regularly. Now, how can you improve your side sleeping position? You know, if maybe you just don't feel particularly supported. So, as we said, alternate the side that you sleep on. so that you've not always got that sort of slight curve on the same side. Certainly elongating the legs and the arms as much as possible, as we can see in the log position. This will really help to support that spine in a neutral position. You know, the shoulders and the hips again are going to be in alignment with each other, and this will again just really help to reduce back and neck pain. The log position also helps to reduce snoring as well, as does there's a slight modification, the yearner position. Now in this position, you know, the back, there is a slight bend at the hips, but the arms are out in front, and so again you've still got a good spinal alignment. You've still got the elongated legs. It's just that the arms, you know, aren't sort of right that you're not going to be lying so much on top of that arm that's underneath. Now, okay, so if you are a side sleeper, what can you do in the way of supporting with pillows and things to maintain that neutral alignment? So you can position a slightly thicker pillow under the head and neck, but not under the shoulders, just the head and neck. This will help to maintain neutral neck alignment, okay? Whereas if it's under the shoulders, you're going to be a bit more, your head's going to be sort of tilted up a bit more. The neck, you know, just ensure that the neck isn't bent up or down. Keeping the knees slightly bent, just in quite a relaxed position. Not pulled right up to the abdomen so that all the organs and everything are sort of kind of all squashed. But just a relaxed bend at the knee is optimal positioning. Again, to maintain the alignment around that lumbar region. Obviously, if you pull the knees right up, you're going to be rounding the lumbar region again, which is going to cause a lot of extra tension. You can also use a pillow between the knees just to help sort of with pressure points, and certainly people who have had strokes, this would be a common thing to do, just to help support and keep everything in alignment. So by doing this, not only spinal alignment around the lower back, but it will also really help with alignment of the hips and pelvis. It will help to reduce stress on the joints, on the hip joints and on the knee joints. It'll avoid, you know, if you didn't have this pillow and the upper knee dropped down, that can also cause a bit of a twist in the lower back and around the pelvis. So just by adding this pillow, it just helps again keep everything neutral. Try not to extend the arms outwards as we saw in the yearner position, because one thing that can do is to increase the strain on the shoulders and the arms. Now, if the fetal position is you know, your position of choice, but stiff joints are also an issue, maybe you've got arthritis or something, you can try to relax the position, as we've said, by extending the legs a little and also untucking your chin. A lot of people, when they sleep on their side, you know, they kind of curve themselves up and the chin gets tucked in. And so, and also wearing wrist splints, you know, if you're someone who kind of bends their wrists back as you sort of curl in, that can put a lot of strain on the wrist joint. So by wearing wrist splints, you know, that can just help keep the wrists well aligned as well. If hip pain is an issue, you can also, you know, as we've said, putting a pillow in between the legs will really just help take the pressure off the hips as well. Now, possible issues with the fetal position. You know, as we've said, it is the most common position. 41% of adults sleeping in the fetal position. This is probably, let's face it, it was the first position that we were ever in. You know, when we were in the womb, we were in the, you know, that sort of curled up fetal position. But, you know, of course it can cause problems. A very tight fetal position, as we've said, it kind of causes unnatural curves. It may worsen things like arthritis in older people whose tissues, you know, maybe aren't as elastic as they once were. A very tight fetal position is also, as we've said, it's going to cause all those abdominal organs to be all squashed up, and this may also mean that the diaphragm tightens, which, you know, again is going to restrict breathing. You know, those of you with IBS, I'll use again as an example. You know, if you know that feeling when you get really bloated and all the diaphragm tightens, and it does affect your breathing. Well, sleeping in a very tight fetal position is going to give you that similar kind of feeling. You know, as much as it is the most popular position, it can also be one of the worst positions due to lack of, I mean, depending how you're supporting with pillows and everything, you know, lack of neck support, lack of spinal support, curvature of the spine, you know, bending back of the wrists, you know, extra strain on the hips. But, you know, as I say, because it's a neutral and a familiar position to all of us, we tend to favour it. Now, possible issues also may not just come down to the position you're sleeping in, but also the side that you're sleeping on. So, sleeping on your left side, we talked a little bit about in cases of pregnant women. Certainly sleeping on your left side, as we've said, in terms of avoiding compression of the inferior vena cava, but also in people who aren't pregnant, arm and shoulder pain may be an issue due to nerve compression on that side, restricted blood flow, particularly if you've got the arms, you know, in an outward position. Back pain due to the lack of spinal support and curvature of the spine as well, where if you're always on one side, you know, that middle part of the body is going to sink into the mattress more and there's going to be more of a curve. And, you know, if you get that curve, that's then again going to place additional stress on the internal organs, particularly on the stomach and also on the lungs. Sleeping on your right side, again, as we've just said, arm and shoulder pain due to nerve compression, restricted blood flow if you have your arms out to the side, you know, all that if you're always sleeping on the same side. Back pain again due to that curve, placing again additional stress onto the organs. Also, sleeping on your right side all the time may actually increase acid reflux, which can also, again, this is another reason why we get pregnant women to lay on their left side, because obviously pregnant women, when all the abdominal organs are kind of pushed up due to the growing uterus, and they're more prone to sort of heartburn and acid reflux. So sleeping on the right side, also, as we said, with pregnancy, may just restrict the blood flow to the uterus and the placenta. So hopefully that's given you a little bit of an idea of how your sleeping position may be impacting on certain areas of tension or muscle imbalances, and also give you an idea of, if you're really set in your ways, how you can support certain areas of the body just to help improve that alignment, take the weight, take the strain off, and therefore reduce pain, tension, fatigue, and hopefully just get a better night's sleep. So that's really it from me on this subject today. Any questions, as always, you can leave a message on this post, or you can contact me on Facebook or Instagram. I'm on there as the Medical Massage Lady, and I will come back to you. Feel free to subscribe. There's lots more videos already up about various injuries and medical conditions, pregnancy related issues. If there's anything that you would like me to talk about, do let me know. Yeah, so subscribe to my channel, you'll get informed when other videos come out. But for now, that's all from me, so I will see you next time. Bye.